Well, you know, there are many different treatments out there to help those who have tested positive for the coronavirus, right? And there's one that we've been hearing an awful lot about. It's called antibody therapy. Local 24 News reporter Brittany Moncrief here now with more on that therapy and its effectiveness.
Antibody treatments have been studied, tested, and used throughout the COVID-19 pandemic. We know they work, but how effective are they? First things first, antibody treatments have been used and are still being used to fight COVID-19.
These antibody treatments are really attractive because they do two things. They very specifically attack the spike protein region of coronavirus, and they do it early on.
Infectious disease Dr. Steve Threlkeld says there are two forms of the treatment. Convalescent plasma, when a person who had the virus and recovered donates blood plasma, and the wider used monoclonal antibodies, which scientists genetically create.
This antibody infusion has been shown to attack the virus and to actually prevent people from getting sick and needing to be in the hospital.
But time is key.
It's only really been used after people already have the infection, but early on before they get really sick.
Convalescent plasma works in the first 2 or 3 days of having COVID and has a wide variety of antibodies. For monoclonal antibodies,
you have to give it within 10 days of the onset of the illness or of the positive test to meet the emergency use authorization by the FDA. And we have had, as little as 3% or so people who got that antibody then go on to be admitted to the hospital.
But here's the catch.
Some of these new variants tend to render these antibodies ineffective. So particularly the Brazilian and the South African variants seem to be able to escape from these antibodies.
These treatments are being offered for those who are high risk for the coronavirus. Doctors still stress getting vaccinated, masking up, and social distancing. In Cordova, Brittany Moncrief, Local 24 News.